You get what you measure. That's the truth, whether we're talking about healthcare, business, or even personal habits. In medical group management, this couldn't be more important. The KPIs you choose to track will inevitably shape your decisions, your focus, and the behavior of your teams. Measure the right things, and you'll drive alignment, efficiency, and growth. Measure the wrong things, or worse, measure nothing at all, and you'll find yourself making decisions in the dark. Welcome to Medical Money Matters, the podcast where you can find experts, answers, and resources so that you can achieve mastery over the financial and business aspects of your practice. Hello, everyone. I'm your host, Jill Arena. I began my career in accounting and finance, and I have more than 30 years of experience running medical groups. I own and operate a national healthcare consulting and revenue cycle company, and I am the author of Physician Heal Thy Financial Self. In 2020, I co-founded the Physician Leadership Project, and my passion is to increase financial and business literacy for physicians. Episode 123, Mastering the Metrics. Which KPIs should you really track? You get what you measure. That's the truth, whether we're talking about healthcare, business, or even personal habits. In medical group management, this couldn't be more important. The KPIs you choose to track will inevitably shape your decisions, your focus, and the behavior of your teams. Measure the right things, and you'll drive alignment, efficiency, and growth. Measure the wrong things, or worse, measure nothing at all, and you'll find yourself making decisions in the dark. Today, we're diving deep into the world of KPIs, key performance indicators, and what you should really be tracking in your medical group. If you're a physician leader, a practice administrator, or part of the C-suite in a private or hospital-affiliated group, this episode is for you. We're going to talk about the real risks of not tracking performance metrics or tracking too many. We'll explore the value of benchmarking, both against others and against yourself over time. And I'll end with a practical breakdown of the top 5 KPIs your board should be reviewing regularly, plus another set of operational metrics every good administrator should be watching like a hawk. And a word of caution before we get started, because this is something I've seen over and over again in the field. When everything is important, nothing is important. That's why today's conversation is about clarity and focus, because leadership is about making decisions, and decisions require data. Let's get started. Let's begin with a scenario. You're sitting in a leadership meeting discussing what feels like a never-ending list of challenges: staff burnout, falling margins, longer wait times, maybe some complaints rolling in. Everyone's got a theory about what's going on, but there's no dashboard, no performance summary, no data to validate or challenge what you're hearing. This is the danger of flying blind. When you're not tracking the right KPIs, or any KPIs, it's easy to fall into reactive mode. You're not leading with insight, you're just putting out fires. You're managing symptoms without diagnosing the underlying condition. The absence of measurement can feel like freedom at first. No spreadsheets, no dashboards, no tough questions. But it eventually leads to confusion, missed opportunities, and inconsistent outcomes. Without metrics, you're guessing. And equally problematic is trying to track everything. Data fatigue is real. Practices can become so overwhelmed with reports that no one knows what to do with them. That's why this conversation isn't just about measurement, it's about focused measurement, strategic measurement, measurement with a purpose. That brings us to benchmarking. Benchmarking gives your KPIs context. When you're looking at your performance, it's essential to ask, compared to what? Without a reference point, it's hard to know whether a number is acceptable, exceptional, or alarming. There are 2 types of benchmarking, and both are valuable: benchmarking against others and benchmarking against yourself over time. Let's start with external benchmarking. Comparing your metrics to those of similar organizations can help you understand where you stand in the broader healthcare ecosystem. Maybe your no-show rate is 7%. Is that good? Nationally, the average might be 5 to 12%, depending on your specialty. But without those reference points, you're flying blind. But external benchmarking has its limitations. Not all practices are structured the same way. Payer mix, region, subspecialty, service lines, all of these factors affect what's quote unquote normal. So while external benchmarks are helpful, they should be used as a guide, not as a gospel. Internal benchmarking, tracking your own data over time, is where the real gold is. Trends tell a story. When you look at data month over month or year over year, you can detect patterns, identify early warnings, and celebrate progress. Let's say your days in AR have slowly crept up from 36 to 44 over the past year. You may not have noticed the gradual change, but when you benchmark internally, the shift becomes clear, and it gives you the opportunity to course correct before cash flow becomes a crisis. So, benchmark against others for context. Benchmark against yourself for insight, and always look for patterns over time. Now let's talk about a common misconception when it comes to KPIs, that more is better. I've walked into practices where the dashboards have dozens, sometimes hundreds of metrics, charts and graphs for every department, every task, every click. And here's the problem. When everything is on the dashboard, nothing stands out. You can't tell what actually matters. This is where the K in KPI comes in. Key performance indicator. Not every performance indicator. Not every metric under the sun. Just the key ones, the ones that truly matter to your goals. Tracking too many metrics leads to what we call analysis paralysis. Leaders can't make decisions because they're buried in data. It's also demoralizing to staff. If they're being asked to improve 15 different things, they don't know where to focus, and they burn out. So how do you choose the right KPIs? You ask yourself, is this metric actionable? Does it reflect a strategic priority? And will it help us make better decisions? If the answer to any of those questions is no, it might be time to let it go. Let's get practical now. Which KPIs should be on your board's dashboard? If you're reporting to physician owners, a hospital system, or a governing board, your focus should be on high-level indicators that speak to financial sustainability, access, and performance. Here are my top 5. Number 1, operating margin. This is your big picture financial health metric. Are you generating enough revenue to cover your costs and invest in the future? Operating margin is the clearest way to answer that question. It also signals when expenses are creeping up or when revenue is under pressure. Number 2, days in accounts receivable. Cash is king in any type of practice. The longer it takes to collect what you've earned, the tighter your operating flexibility becomes. Tracking days in AR helps spot issues in billing workflows or payer delays early. Number 3, provider productivity. Work RVUs per FTE. Whether you use work RVUs, total RVUs, visits per day, or sessions worked, having a normalized view of provider productivity and coding aptitude is essential. It helps ensure equitable workload distribution, informs compensation models, and supports growth planning. Number 4, patient access, days to next available appointment. This one is simple but powerful. If your patients can't get in, you can't grow. Delays in access can signal provider shortages, poor scheduling efficiency, or burnout. And it directly impacts patient satisfaction, which is number 5, Net Promoter Score, NPS, or patient satisfaction composite. Quality of care is difficult to quantify at times, but experience is easier to track. NPS and other survey-based metrics give insight into how patients feel about your care, which ties back to retention, referrals, and revenue. You're listening to Medical Money Matters, a weekly podcast brought to you by Healthy Practices, a healthcare consulting and revenue cycle company dedicated to keeping our clients independent. Please reach out if we can do anything at all to support your practice. You can find more information online at healtheps.com. That's www.healtheps.com. Please follow or subscribe to get all future episodes downloaded as soon as they're released. Now, let's talk about what you should be tracking at the manager or operations level. These KPIs drive day-to-day decisions and performance improvements. Here are 10 to consider. Number 1, denial rate by payer. This helps identify which payers are causing the most rework and delays. You can't fix what you don't see, and denial trends offer opportunities for better coding, documentation, or contract renegotiation. Number 2, charge lag. This is the time from when a service is performed to when it's actually billed. The longer the lag, the slower your cash flow. Tightening this window improves revenue cycle performance and improves cash flow velocity. Number 3, staffing ratio, typically shown as support staff per provider. Overstaff and your margins suffer. Understaff and your providers burn out. Finding the right balance is key, and this metric gives you the data to manage it. Number 4, schedule utilization percentage. Are your appointment slots being filled efficiently? High utilization often correlates with strong access and revenue, but too high might suggest overbooking and burnout risk. Number 5, no-show rate. This metric impacts both revenue and patient care. High no-show rates reduce access and strain resources. Tracking and reducing this low-hanging fruit for many practices. Tracking and reducing this is low-hanging fruit for many practices. Number 6, patient turnaround time. From check-in to check-out, how long are patients in the clinic? This impacts patient satisfaction, staff workflow, and clinical efficiency. Number 7, phone call abandonment rates. If patients can't get through, they go elsewhere. This is especially critical in high-volume practices and specialties with high follow-up needs. Leaving your patients on hold interminably signals that you don't really value their time. Number 8, cost per encounter. Understanding your cost structure at the visit level helps evaluate pricing, negotiate contracts, and plan service mix changes. Number 9, authorization delays. Track how long it takes to get prior authorizations and the impact on care delivery and revenue timing. This is a frustrating but essential metric. And number 10, percentage of clean claims on first submission, also sometimes called first pass rate. The goal is to get paid the first time, every time. A high clean claim rate means your front and back end processes are working well. 90% should be a baseline, with 95% plus as a best practice. Notice something about all these metrics? They're actionable, they're specific, and they connect to broader goals like access, cash flow, and efficiency. To wrap up, let's go back to the core idea. You get what you measure. Measurement isn't about creating more reports, it's about creating better decisions. It's about clarity, alignment, and progress. When you choose your KPIs wisely, you empower your team to focus. You give your board the visibility it needs, and you, as a leader, can guide your practice with confidence. But remember, if everything is important, nothing is important. Don't overwhelm yourself or your team. Start with a focused dashboard, build consistency, and grow from there. Thanks for joining me today. If this episode helped clarify which KPIs really matter in your practice, I'd love to hear from you. And if you're wondering whether your current metrics are telling the right story, drop us a line. We're here to help. Until next time, stay curious, stay strategic, and keep mastering the metrics. At Healthy Practices, we know that compliance can feel overwhelming. The rules change constantly, the risks and penalties are real, and most clinics don't have the time or in-house expertise to stay on top of it all. That's why we've developed a range of subscription-based compliance services to meet you exactly where you are. First, there's our compliance DIY model. This is perfect for practices that want to stay compliant but just need the right tools and guidance to do it on their own schedule. Next, we offer our Compliance Learning Collaborative. This is a great fit for teams that want to grow their internal knowledge while staying current with evolving regulations. And for practices that want dedicated leadership without the cost of a full-time hire, we offer fractional compliance officer services. One of our experts partners closely with your practice, acting as your go-to compliance resource. From audits to staff training, from policy updates to incident response, we've got your back without blowing your budget. To learn more, visit healtheps.com or reach out directly. We'd love to help you build a smarter, safer, and more resilient practice.